Good afternoon, ladies and gentlemen. My name is Nadia, so I'm the new head of research of AFCA, so the African Venture Capital Association. And I would start by saying that I think that in this room, we will all recognize that the healthcare sector is recognize the huge role, I would say, of the healthcare sector in our societies, and more, the role that the sector has played during the pandemic. And the pandemic has, of course, underlined the industry importance. So let's have a look on the macroeconomic facts. Okay, here is another view of the public financing for the health in Africa. So we can see that the average domestic general government health expenditure per capita in Africa was $62.98 in 2018. And this, when we compare to the government health expenditure as a percentage of the GDP, which is, we can see in the map that the Southern Africa region was the highest in terms of percentage. So this was driven by three main countries. So the highest was in Lesotho, 5.39%, followed by the Botswana, 5.53%, and South Africa, 4.46%. When we compare it to the general region in the world, we can see that taking the health expenditure per capita also, we see only the 62.9%, which is less than half of the emerging market region, for example, which is $151.60 per capita. So the average domestic general government health expenditure per capita in Europe was times 28 higher than the same in Africa in the same period. But we can also notice that the continental average for healthcare expenditure per capita in 2018 was marginally exceeding the average health spending recorded for low-income countries in 2017, which was $41 US dollars a person. When it comes to the health expenditure percentage of GDP, we clearly see that the African average health expenditure still lags below the conservative target for government health expenditure proposed by the United Nations, set as 5% of GDP. What about the continental initiatives? We have the Abuja Declaration and the Universal Health Coverage. So the first one pledge made by the heads of state of African Union countries in 2021 to allocate at least 15% of the annual budget to improve the health sector. Whilst several African governments have increased the proportion of the total public expenditure allocated to health, government spending on health has grown slowly and is far from the aspirational goals of the Abuja Declaration. This is the first takeaway. Concerning the universal health coverage, so targeted in the United Nations Agenda for Sustainable Development, so it's the SDG 3, good health and well-being. So again, although most African countries have integrated UHC as a goal in the national health strategy, progress in translating this commitment into expanding domestic resource for health has been really slow. Talking now about the financing gap. So as a guide on how much countries should spend on healthcare, the United Nations for Africa proposed a conservative target for government health expenditure as of 5% of GDP. And based on this benchmark, they say that 114 billion per annum is needed to meet this minimum threshold. And in 2015, government health expenditure in African countries only amounted to 46 billion, leading to a financing gap of 66 billion per year. The Healthcare and Economic Growth in Africa report found that more than half of the amount is required by Egypt and Nigeria. So these two countries comprise 23% of Africa population, but face a shortfall of 51% of the total financing gap on the continent. So what's the role of the private sector then? The private sector is playing an increasingly important role in the health financing in Africa. Private sector healthcare providers currently deliver nearly 50% of all healthcare in sub-Saharan Africa. Close to 60% of healthcare financing on the continent comes from private sources, and 36% of healthcare in Africa is financed through out-of-pocket expenditure. So meeting the needs of Africa healthcare demand is $1 billion market opportunity for the private sector. So opportunities for business addressing health-related challenge will reach $259 billion by 2030, with the potential to generate over 60 million jobs in Africa. So now let's talk about the private equity and venture capital investment in the sector. When we look at the overall period from 2015 to 2021, we can see that the share of volume of African PE and VC fund investment for the healthcare reached 8% versus 5% for the share of value of all the overall African PE and VC fund investment. So when we look at the big picture, we can clearly see that the healthcare sector arrived at the 7th position comparing to the other sector. But this sector has seen an increasing interest from the investor. On the left side chart, although the share of the volume stay relatively stable between 2015, 2017, and 2018, 2021, we clearly see that the share of a value has increased by 75%. 75% goes of a particular dynamic 2020 year, when we saw a large deal, more precisely in the North Africa region. Another indicator showing the continued interest from the investor side is the number of companies that have been invested during the period. So we can clearly see that they have only invested 35 companies from 2015 to 2017 against 62 companies from 2018 to 2021. So this represents an increase of almost 80%. Okay. This is the number. On the left, you have the number of deals between both periods and the value of this deal. So here again, we can clearly see the increasing interest for the healthcare sector from the private equity and venture capital fund in the world. Okay, what is it comparing to the other region in the world? We can clearly see that in terms of volume, so Africa lags below the level of the other region. So clearly in Europe, healthcare sector represents 16% of the total volume of the PE and VC investment. In France, it's 16%, and UK, 15%. But this is so the percentage 2020, so at this point. In Africa, we have seen a clear increasing of the value, the share of the value on the total PE and VC investment, which reached 16% comparing to only 3% in 2019. Because we've seen large deal, as I said, in North Africa especially. In terms of region, we can see that the share of the volume and value of PE and VC fund investment is driven by the West Africa, North Africa, and also the East Africa. The West Africa is clearly driven by the Nigeria, and in North Africa, we've seen large deals, notably in Morocco, on this period. In terms of industry group, we clearly see that the healthcare equipment and service represent more than 3/4 of the overall investment in healthcare. And behind that, we can note that the healthcare tech represented in 2020 50% of the total investment in the healthcare. The healthcare industry is driven by the growth strategy and venture capital. So this has been the case from 2015 to 2021, but more especially in 2020, where the venture capital deal represented almost 50% of the overall investment in healthcare. In terms of deal size, we see that the market is driven by the deals under less than 10 million, so because they represent 55% of the total value of the PE and VC fund investment, but only 9% in terms of value. But the segment 10 to 49 million really is the most predominant in the sector because it represents almost 40% in terms of volume and also almost 30% in terms of value. Okay. So we'll end with the Healthcare in Africa fundraising. So in terms of perspective, we've seen that between 2015 and 2021, so the total value of final closes PE and VC funds in Africa was $18.6 billion. Of this, 50 originated from funds that included healthcare as a targeted sector. And a survey made by Africa in April 2020 showed that healthcare and life science were identified by the highest proportion of LPs and GP alike as an attractive set of the PE investments for the next 3 years. So this is a good sign. We think that the trend will follow the next coming years. That's it. And you have just an idea of some of the fundraising that we collect from 2015 to 2021. I think I'm done. Do you have any question? Sorry?
With the pharmaceutical activities. Oh, sorry, thank you. Sorry about that. I just wondered whether you had a sense of the geographical split and dominance of, for example, pharmaceutical, and whether that cuts quite differently versus the healthcare equipment and services? Because I think you've put them together in your geographic. Do you have a sense on where the pharmaceutical concentrations are and whether they're a little different?
No, to be honest, I don't have the figures now.
Okay.
But it's something that we can.
That's fine. I can connect with you afterwards.
Sure.
Thank you. It's very
Thank
interesting.
You. Yeah.
Cheers. Thank you.
You're welcome.
Okay, unless there's any more questions, I think we'll thank you there for your presentation. Thank you.
Thank you.